The Role and Responsibility of Community and Public Health by Roberta Price. The Role and Responsibilities of Community and Public Health. Those who take the lead in the healthcare setting have many responsibilities. Community and public health is in place to serve the community for the betterment of the health of the people. Although the roles and responsibilities of the public health workers is challenging, it is necessary for our society to maintain healthy communities. This paper will discuss the role of community health as it relates to the population. Additionally, the structure, the legal and ethical dimensions, funding, and communication in community and public health programs will be addressed and highlighted. These are the 5 areas that will be discussed. The role of community and public health in the well-being of the population, the public health organizational structure, examining the legal and ethical dimensions of public and community health services, analyzing funding and public and community health services, discussing the role of communication in community and public health programs. Number 1, the role of community and public health. Public health is a necessity for our society in order to maintain and control diseases. Without public health care, our society will suffer. Public health promotes healthy lifestyles through education, prevention, and many services that are available to members of a community. According to Lennox, today's public health is concerned with society's interest in the health of the community as a whole. In 1988, the Institute of Medicine of the National Academy of Sciences declared that public health consists in fulfilling society's interest in assuring conditions in which people can be healthy. Public health organizational structure has changed as time and society is changing. It includes all the necessary resources for a community to achieve optimal health. Education, finance, and human resources are all components of the structure of public health. The U.S. healthcare system is unique. It blends private and public sectors. According to Frist, the U.S. healthcare system's structure and funding mechanisms are unique due to the blending of private and public resources. The majority of Americans under 65 years of age covered by employee-sponsored health insurances is declining slightly from 58.6% in 2010 to 58.3% in 2011. This is attributed to the impact of the Great Recession-based unemployment. The legal and ethical elements of community and public health services have a direct relation on how citizens are treated and how services are implemented. As stated, state and local laws mandate the reporting of specific infectious diseases to health departments, which in turn use these surveillance data to monitor trends, obtain funding, and allocate resources for controlling infectious diseases. And this is taken from the American Journal of Public Health, June 2014. The funding of public and community health services has changed over the years and is complex. According to McGill, a series of cuts to the U.S. agencies, including public health, that took place March 1st after Congress was unable to develop a plan to reduce the deficit by $1.2 trillion over 10 years. Those cuts forced public health agencies to scale back, such as the Centers for Disease Control and Prevention, which had 285 million or 5% cut from its fiscal year 2013 budget. The role of communication in community and health programs, as stated by Elliott. Communication in health starts from the perspective that health is a social cultural phenomenon, but its very embodiment pushes against the notion that health is simply an object to be studied like any other object. Therefore, communication is paramount in coordinating patients' care, so it is a necessary component of public health. Although the roles and responsibility of the public health worker is challenging, it is necessary for our society to maintain a healthy community. This paper described public health as it relates to our society's population. It highlighted the structure, the legal and ethical dimensions, funding, and communication in community and public health programs. Those who take the lead in the healthcare setting have many responsibilities. Public health is in place to serve the community's healthcare needs, to prevent epidemic and catastrophic infectious diseases from spreading. Thank you.